this is Dr. Doug Smale with Digital Dental Surgery, and this is Nobel Temp Shell Part 2. In this video, we're going to show the prosthetic phase of the TempShell process in great detail. At the end of the video, we'll have a link to our website, and that'll have an outline of the steps shown here for this video. Here are some pre-surgical photos. Thankfully, he has a low smile line. And in this case, the tooth had already been removed and the socket was grafted. I chose a flapless approach so there'd be no incisions of the papillae or any vertical incision scars. We plan all of our cases fully guided, which is essential to be sure the implant is in the correct position for a future screw-retained final prosthesis and for preservation of the buccal plate. Note that there's plenty of buccal tissue height and thickness after placement. Try in the TempShell first to be sure it seats before you put the snap abutment in. In this case, you could have done that prior to the surgery, but most cases that we do are immediate implant placement after extraction. Now, place the snap abutment. Remember, it goes axially. Don't twist or torque the implant as you press the abutment into place. Recheck the TempShell. You'll almost always have to reduce the snap abutment so the TempShell fits passively for the pickup stage next. Take a radiograph to confirm that the snap abutment is in place. And we now place some Teflon tape or cotton in the snap temp access hole. Nearly fill the shell with flowable composite. Gently place back and light cure for 30 seconds. Gently remove the temp shell, and it should have picked up the snap abutment as shown here. I place flowable and develop the intaglioside and emergence profile first. Don't over contour or the gingiva could recede later. The burrs shown are part of the implant temp burr kit. Place the temp shell on the analog holder and carefully use the long access hole burr to drill the access hole all the way through the crown. Take a minute to be sure all the shavings are out. Now, open the access hole at the incisal edge and continue all the way down to the snap abutment. The driver and screw head are larger than the long access burr, so you have to open up the hole all the way down. Long shank burrs are included in the implant temp burr kit. So now try in the driver first, then check with the screw. You have it right when the screw goes all the way through and you can just see the threads coming through the bottom of the snap abutment. I use an irrigating syringe with chlorhexidine to flush it through and be sure that the screw hole is completely clean. Okay, final try-in. Make sure it goes down all the way and the wings are seated. You'll usually have to reduce a little bit more on the intaglioside so it seats with minimal tissue pressure. I like to check the occlusion first here as it's stabilized by the wings to protect the implant. Great, now you're almost done. Now cut off the wings, polish it up, make sure it's out of occlusion, and rinse it well with chlorhexidine. Please reinforce the soft diet instructions, again, for at least 6 to 8 weeks. I tell my patients it's for viewing, not for chewing. All right, final placement. Check the contacts to be sure they're very light to minimize pressure on the implant. Torque it down one time. Remember, the implant goes in at 35 to 50 Newton centimeters, so 15 to 20 should be fine without loosening the implant. Fill the access hole with flowable. After you put some Teflon tape in there, polish it up, and you're all done. I hope you enjoyed this video. I'd love to hear your comments and suggestions. You can email me at easthudsondocs@gmail.com. And again, check out our website, www.digitaldentalsurgery.com, for more information and how to order the temp burr kit. Thanks.